Welcome back, class. It's Dr. Linder. Let's take a look at the urine analysis, just some basics about it to give you a little bit of an understanding of what's being measured here. Typically, how it's done in most clinics or walk-in clinics is the clinician will ask the patient to urinate in a cup, and then the clinician is going to take this dipstick that has different litmus paper that is sensitive to different things. We'll dip it inside and either manually inspect it to the key, or they'll run it through a little computer that will spit out a print up of everything that it's looking for. So you can see that there's different colors on this strip, and you can see on the bottle there's different colors. And when you hold it up to it, it's like a grading scale. It tells you what it is. So, like here on this dipstick, we can check for leukocytes. We could check nitrites, urobilinogen, protein, pH. Is there blood in the urine? What is the specific gravity? Are there ketones, bilirubin, glucose? And we want them all to be in this first column, right? Negative, 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 negative. It's all good findings if it's negative. Once we start to move in this direction, now it's kind of like trace, like slight evidence of it means trace, or there's a low amount or a high amount, right? The more we move to the right, the more serious the condition, obviously. Okay. So, also, these different tests, so like it tells us leukocytes, we'll check this in about 80 seconds, right? Some tests may say 120 seconds, which means you're going to wait close to 2 minutes before you check this result. But if we're checking ketones, here it's 40 seconds. If we're checking glucose, you want to check that at 30 seconds, right? So each one is calculated at a different time frame. And different tests from different companies may tell you on the strip at what time frame you're going to be checking these. So what do some of these things measure, right? So when we're looking at pH, well, that can let us know if there's some sort of respiratory or metabolic acidosis going on or alkalosis. Are there any defects in renal tubular secretion and reabsorption? Well, protein can be checked. This will determine whether or not there's any damage to the glomerulus, if there's impaired tubular reabsorption, if there's serious diseases like multiple myeloma or preeclampsia or orthostatic and postural proteinuria or a diabetic nephropathy. Is there glucose in the urine? That can be seen with diabetes mellitus or impaired tubular reabsorption. Pregnancy with possible latent diabetes mellitus. Is there ketones? That could be seen with diabetic ketoacidosis, or if a person is in a fasting state, just breaking down their own fat, then their body's going to push out ketones. If there's bilirubin, then there's going to be some sort of liver issue like a hepatitis or cirrhosis of the liver or a biliary obstruction. Are there nitrites? That could be seen with cystitis, pyelonephritis. It could be seen with people at high risk for urinary tract infections. Specific gravity is checking hydration levels primarily, and leukocytes for UTIs, for urinary tract infection. So a urine analysis, a UA, can give us lots of information. It's not an invasive test. They're pretty cost efficient, and should be done. Two other blood tests. These are now blood tests. These are not done through urine, but two blood tests that could be done. One's called BUN, which stands for blood, urea, and nitrogen. And it measures the level of nitrogen in the blood that's part of urea, which comes from the breakdown of proteins. So BUN is one. And another test is the measurement of plasma creatinine. Okay. And that is the result of the breakdown of creatinine phosphate, which is in skeletal muscle. And the kidneys have to function in a way to clear this from the urine. If it's not clearing it and the creatinine is high, then there's a problem with the kidneys, typically kidney failure.